Can you just talk a little bit about, in your experience, how putting diagnostics increase the value actually of your practice?
Yeah, I kind of lost for a second there, but yeah, in terms of just my experience, we put diagnostics in our practice in 2013. And really, we did it back then purely, the primary motive was raising the autonomy level of my therapist, improving the ability to make a diagnosis, give these therapists the ability to play in the sandbox that only neurologists and physiatrists were playing in, and just give them more opportunity. And that was the primary purpose then. I didn't know 7 years later when I went to sell my practice and the value of diagnostics and a strategic buyer had in that. And when we sold the practice, the EBITDA was extremely strong and diagnostics played a significant role in that. But the strategic partner saw how diversified we were, that we had exclusivity in our entire town. We were the only ones doing diagnostics. My competitors couldn't. So the value was huge for a buyer. And we got a 9 multiple when I sold the company. And I really, truly believe that diagnostics played a significant factor in that. And especially today, looking at what's happening in reimbursements, if I was a buyer, I would absolutely love the idea that a private practice had diagnostics and generating that kind of income and sophisticating their practice to that level.
Cool. And you know, I don't want to end tonight's conversation without adding that aside from looking at innovation and bringing services, advocacy for higher reimbursements is also very important.
Yeah.
Physical therapists and other healthcare providers getting together, forming groups and organizations where legally and collectively they can work together in advocating higher reimbursements and negotiating higher reimbursements. I think it is a very important path. You see, you cannot just have one strategy, one area only. You have to take all the possibilities, your entire arsenal of possibilities, and implement it, right? I mean, I'll tell you, in our practices in New York, we have 3 types of physical therapists. We have physical therapists who do only PT. We have physical therapists who do only diagnostic testing. We have physical therapists who do hybrid, half PT, half diagnostics. So we provide, we have developed a very robust business in diagnostics. In other words, what I mean when I'm saying robust, I mean that what we bring as income from our diagnostic business, despite the fact is smaller than our multi-year developed physical therapy business, our diagnostic business brings equal income with our physical therapy business. But there you see the disparity. Despite the fact the diagnostic business and physical therapy business, they bring the same revenue in total, the diagnostic business profit margin is much higher compared to the physical therapy profit margin, if you look at them in isolation, right? So, and of course, do we have cash-based programs also? Of course we do. We have some cash-based programs also into the office, and we have those programs that would truly benefit the patient. But our core, looking outside of the box, innovation program, moving ahead from our competition, our program that creates our robust EBITDA is our diagnostic testing program and that part of the business. Let me see, there were some questions. So There is a question if physiatrists or neurologists push back with having us play in their sandbox. So here is what I'm going to say. If you do this only with the intention to make money, and you are not producing a quality product, then everybody will push you back. I'll push you back. Because the primary purpose for doing this is and should be to help the patients. And as a consequence to that is that you are making significant higher reimbursements and significant additional revenues and profits. Now, in our program, first of all, I have to say that our organization in New York, I know the same, Dan, was for your organization in Florida before you moved your exit strategy. And the people associated with us, with HUDs, the caliber of the work that we provide when we do testing is such that is being recognized by large hospital organizations, medical centers, and physicians who are sending patients to us because they know of the quality of the work that we do. In some cases, they send us patients. We get sometimes referrals from neurologists of cases that they would not do. Okay?
Yeah.
Not all neurologists would do pudendal nerve and other areas of the body that are more sensitive to test. But we do. Also, remember that the way you implement this program is not only by you doing it on your patients and you billing only, but you can offer this as a service to those neurologists, to those physiatrists, to in primary care, internal medicine, family practice, orthopedic offices, medical centers. You offer it as a service where they can also make revenue from those services, and then you can reap also the clinical and financial benefit. Now,
Denny, can I speak to that too for a second?
Sure. Go ahead.
So Brian, just to speak to that, also, over the years, we respected certain referral sources. Like this one neurologist said, look, I know you're doing diagnostics, but I'd rather you not do them on my patients. No problem. So we didn't do that. And I'm a firm believer there are so many doctors out there that if Dr. A doesn't want us to do that on their patients, no problem. We'll go to the other 5,000 doctors in our community and promote our services. And I really never wanted to have my practice dictated by a physician who wasn't happy with the service that I performed, and quite honestly, somewhat better in many cases than what they do, given the level of the residency program. And we just decided to continue to flourish, expand it, and grow it, and didn't really put too much attention on that one doctor that might not want us to do a diagnostic test. And then the other day, I had a call with a neurologist that he has a neurology practice and a PT practice. He wants us to train his PT to do the diagnostics because he doesn't want to be bothered doing the test for an hour. He loves the idea that his PT down the hall can do the diagnostics and he can do something else, maybe do other type of medicine or golf, So I think more and more physicians, they see the value of what we can provide, and you'll be shocked at how significant that is.